Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenectomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome, everyone. Welcome back to today's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today I have the pleasure of introducing you to Dr. Erick Galindo Valdez. He's the founder of Centro TOTS in Guadalajara, Mexico, specializing in diagnosing and treating oral restrictions in newborns and children. He's a pediatrician with over a decade of experience and combines expertise in early childhood development with advanced training in laser frenectomies. He takes a multidisciplinary approach, guiding families and collaborating with specialists to ensure comprehensive care. As a board member of ICAP, a member of the American Laser Study Club, and an ambassador for the Breathe Institute, Dr. Galindo is dedicated to improving outcomes for children with oral restrictions from breastfeeding through their childhood. So welcome, Dr. Valdez. Can I call you Dr. Erick? I don't know why I feel like I've been calling you Dr. Erick in my head. Is that from Instagram? Do you say Dr. Erick?
Yeah.
Yeah.
Exactly.
Yeah.
And for my patients.
Yes. Yeah. Excellent. Yeah. Children like first name basis, right?
Yeah, it's pretty casual and at the same time it's professional. So yeah, yes. I feel very comfortable by people calling me Dr. Erick.
Perfect.
So that's amazing. Go ahead.
Perfect. So many things in your bio, I almost want to stand up and clap and say, yay. The words that come through. First of all, we'll talk about today the fact that you're a pediatrician doing this work. Second of all, the interdisciplinary nature of what you do. And the third thing that makes my heart smile is the idea of all the specialized education that you have achieved and being a part of these collaborative organizations. We met in person at ICAP, right? Last year? Was it about a year ago? And how exciting was that?
I felt I was meeting so many important people in the field.
Yeah.
Starting with you, I finally met Robin, America Walsh, and everything started from Dr. Baxter. I knew him just 2 months before ICAP, and that made the motivation keep going to be among the top in the field. So that's why we met each other. We took pictures.
Yeah, it's fun.
And I knew about your podcast.
So the exciting thing about these collaborative meetings, and I talk a lot about ICAP on the podcast because I think one of the most important things we can do is collaborate with each other, especially from different parts of the world. And you're located in Mexico. Tell me a little bit about how different things are in Mexico, and was this well accepted, your type of care that you're providing to your patients, or you an outlier in your community?
Well, as a pediatrician, I could be a little bit of an outlier, and I think I didn't have much idea on how collaboration. Like at ICAP, we mentioned that collaboration rocks.
Yeah.
And now identifying that oral restrictions have so many connections, and the root cause could be in the womb, but it affects all aspects of life and for all lives of human beings. And I remember meeting Dr. Kevin Boyd, for example, the pediatric dentist from Chicago. And he has this amazing anthropological view on how things affect the craniofacial complex. And that it's not just oral restrictions. It's all these neurological connections, all these muscles, all the nervous system. So to me, to answer your question, I didn't see it this way. And being a pediatrician for more than 10 years, almost 20, I think in private practice, there is not that deep view. And I think that goes in detriment of the help of the families and the children at the right moment.
Yeah, I agree. And I am frustrated that more pediatricians aren't opening their eyes like you did. I didn't learn about this in school. You didn't learn about this in school, but that's no excuse for not being able to open your worldview, your paradigm, and see these kids. Especially, you have the unique opportunity as a pediatrician to see kids at all stages of development. And you can, I would imagine, because I see this in my own patients, the progression if things aren't handled or taken care of, right? So maybe they're not babies anymore, but now they're starting to talk, or now they're school aged and having sleep difficulties and attention deficit. And that could all be traced back if we look at their health history, right? So at what point are you going nuts? If I just learned this and then I saw the kids, how do you handle that with the parents? Oh, this was missed and now we have to do such and such. How do you do that? I'm just curious.
Yeah, it's interesting. Even me talking to you as an expert in the field of breastfeeding, and then as a pediatrician that I get nowadays more kids having trouble breathing, and some, for example, retained or not well integrated primitive reflexes. I see that the connection could have been all the way back to the way they were using the breathing, swallowing, suctioning mechanism. So I go all the way back to connect what could have happened. The usage of the bottle, pacifiers, nobody identifying that the kid was sleeping with their mouth open, that kid had some torticollis or plagiocephaly, And now you see that they're struggling even with their fine motor skills.
Mm-hmm.
So it's mind blowing how I could find and have a conversation with parents and tell them, well, it's not only about going to the ENT and getting your adenoids or tonsils removed. It's not just treating your allergies. Has anybody told you that your kid has this oral restriction? And it's not only about putting the tongue out.
Mm-hmm.
It's about the tongue. It's just like this, the tentacle of an octopus, right?
Right.
So it's so malleable and has so many functions in connection with oral-facial complex.
Right. And sometimes I think about the tongue tie is just a symptom of underlying tension patterns or positional patterns or habits, right? It's just that's what we can see, but what's underneath, like you said, the tentacle that we see, right?
Exactly.
Yeah. So is this well received by the families in your care? Does it make sense when you explain it? Because in my practice, when I see a family that they'll come in with the baby and I'll ask about breathing, I ask about family, and they'll say, oh yeah, my husband has sleep apnea.
Uh-huh.
And then we trace it back and we make the connections and light bulbs go off. The understanding and the connections get there. And they're sometimes angry at other providers. They feel a little guilty, that they didn't know this, or feel mad, or upset or whatever. Do you have that? Is it well received in your practice when you're connecting the dots for people?
It's more than well received.
Beautiful.
On the one hand, what you have is still a lack of deeper understanding and trying to put them to families in simple ways. That it's like they see my post on social media, they think it's all about the tongue tie. They come to me and says, well, I saw your videos. I know my kid has a tongue tie. Could it be just release it and we'll be done with it?
Don't we wish?
And sometimes it's so frustrating because nowadays, from all the things I have learned, especially this year, it's like we have to start a process. The prehab, either going to a myofunctional therapist, a speech language pathologist, anyone that knows about oral motor function. So we go through the prehab, and so what's frustrating is that I tell them all the process you have to go down to. Mm-hmm. And the older the kid gets, even myself or anybody who has these issues, is that the longer you wait, the longer it's going to take for you to see results.
Absolutely,
right?
Yes.
So that's what I have. But it's well received on the one hand, and on the other hand, sometimes it's like frustrating because to see how long it could take to get fixed.
The older the child, the older the adult, the longer the process takes. And you mentioned your own self. I often mention my own journey. Right now I have them out, but I'm up to Invisalign at this point. I really need expansion. I need surgical expansion, but, it's hard. It's hard. So we do what we can to optimize things, right? So you mentioned, of course, the prehab. For those who don't know what that means like getting ready for the release. It's not just about the release; it's getting ready. And you mentioned myofunctional. You mentioned speech language pathology. I'm sure there are lactation consultants for the babies.
Yeah.
Do you have a team locally? Was it hard for you to find that in Mexico? Because there's not too many people in Mexico doing what you're doing.
As a team, as what I've learned from you in the field and all the experts at ICAP, all the body workers, I've learned so much from dentists, therapists, especially therapists, physiotherapists, myofunctional therapists, all these SLPs, all these specialized people. So what's been hard to find here in Mexico is your team.
Right.
People that know how to work together, people that know how to connect the dots. But I'm happy to tell you that I'm happy and proud that I've found my team.
Excellent.
So I at my office, we are not together, but we have I call it the breathing dream team.
That's beautiful.
So from the start, I have a lactation consultant for the kiddos younger than 1. I have an IBCLC, and I have 2 amazing physiotherapists that know a lot about neck torticollis, flathead plagiocephaly, and a lot of the retraining of the suction swallowing breathing mechanisms.
Beautiful. So you've put that together.
Yeah, I think as a pediatrician, as I was telling you before, even if I should, air quotes, not be doing the releases because I'm not an ENT, I'm not a dentist. I mean, I've trained myself to be that and to do that, but I still am the glue that makes this cohesion of all these specialists, you know? Because here in Mexico, I'm a primary care provider. So families, they don't go directly to a physiotherapist. Maybe they do go to an IBCLC or a lactation consultant, but the pediatrician sees the whole picture.
Right.
And that's a very important part for the families, to find someone that it's guiding all the time, interpreting the information, telling them all the way how to go, how to connect the other specialties.
So it's interesting that you feel that you shouldn't be doing the releases because it's in your scope. It's just there's not so many pediatricians that are doing this. But there's even, you know, I'm a midwife and it could be in my scope if I wanted to do it. I don't do it for other reasons. It's more about medical malpractice, and being a midwife is very challenging because everybody's always out to blame the midwife for things in the United States. So there's that. And also I always had excellent providers that I could refer to. But I know there are quite a few midwives who are doing either scissor release or being trained to do laser. So it's certainly within your scope as a pediatrician. And I think it's ideal. Like, it's the best, as you said, the primary care aspect of that, seeing the whole picture of health is where we should be, because we learn in silos, right? I say this all the time, like, you didn't learn from an IBCLC in medical school. I didn't learn from a pediatrician. I didn't learn from anybody else but the person. When I was learning to be a nurse, I learned from nurses. I was learning to be a midwife, I learned from midwives. When I was learning to be a lactation consultant, I learned from other lactation consultants. So we have to start understanding each other's scopes and roles and working together. And it's not easy, and I commend you for being able to do that in your area. It takes a long time and a lot of effort to put that together.
Yeah, it's been, this year especially has been a great ride, because it's been an exponential learning curve. And it's been 2024 has been amazing. I connected with the Breathe Institute, with the American Laser Study Club, ICAP, even becoming a board member. And it's learning from other fields, and then trying to find that your work matters. Right. And I mentioned that I felt a little bit awkward about me performing the releases, because pediatrics, as you can know, it's not a surgical field. But I've been investing a lot of time and resources to get the proper training and to perfect what's a little but very important piece of the puzzle, knowing how to do a proper release, because that matters a lot. But you have to do it along with the other specialties, because if you think, as you've mentioned it so many times, it happened to me yesterday with a patient. It was a 1.5-month baby having a lot of issues with breastfeeding, and it definitely had a tongue tie, but I didn't go ahead and perform the release, because the baby was not breathing properly, had a lot of neck tensions. So I said, I know you want me to do the release right now, but I know from experts and from proper experience that I probably gonna make things worse. Because it's a wound. You have to go inside the baby's mouth. The baby's hypersensitive when you touch it. You cannot imagine, Lisa, you definitely know how you go into a baby's mouth when he's hypersensitive and tense.
Right.
And as soon as you touch under the lip, baby starts crying intensely.
Right.
So
you're going to cause more trauma to that baby and more. And it's the people that do those immediate releases without thinking of that cause this field to have a bad name, because that baby might have an oral aversion after that kind of treatment. And then they'll say, see, the release didn't help and things got worse and the baby never nursed again. And then they're talking about how bad we all are.
Yeah, it's a lot. And especially, I want to take a few seconds to say how in Mexico there's a lot of work that needs to be done.
Yes.
In order for us not to do this service, the service of the benefits of a good release, because there are still a lot of people, even some IBCLCs, that just do the releases. And I ask the parents, they come here for a second opinion to me. They seek for help. And I ask them about procedures and the protocols and the exercises, even if there's no consensus about exercises all over the world. I mentioned, did the IBCLC tell you anything about that? And they just go, no, they just did the snip or the cut. And that was it. Mostly here in Mexico, the release providers use scissors. And I've seen, because of my social media presence, I've seen people from all over Mexico that come to me because they identify their kids with a tongue tie but just a tongue tie. They don't know about buccal ties or lip ties.
Right.
And they tell them, well, your kid, even if it's 1.5, 2 years old, it has to go to the OR under anesthesia. And it's going to be pretty expensive, almost unaffordable.
Right.
And everybody for surgical, like for any kind of non-scissors procedure, they tell them they have to go to the operating room.
Right. And have anesthesia and all that trauma.
Yeah. And they come to me and I tell them what I've learned, especially from Ireland or the US and Canada. And I tell them, no, this is a procedure that can be done here at my office with topical anesthesia.
Right. So let's say let's shout out social media for a good purpose here, because we get a bad rap. And there was just an article that I'm not even going to point people to, talking about how much misinformation there is about oral restrictions and tongue tie on social media. And they don't tell you who the posts are, but I guarantee we're a lot of the posts, me and you, right? So, but look at how much education, outreach we've been able to do with our social media, right? So responsible social media is not a bad thing. There are some crazy people out there saying silly things, but that's going to happen no matter what, and in any field, right? So I think that I'm grateful for the platforms that helped us meet, helped you and I both connect to other professionals and get the word out for parents to start empowering themselves on this topic. So
exactly. Yeah. I second you on that. That's a big shout out to the good or the positive use of social media. As I think Dr. Bobby Gahiri mentioned a couple of days ago. I mean, it's good that we are here and we find that there's these kind of articles circulating, and then we can do the counterbalance, right?
Right.
We have to keep pounding and expressing how the evidence works, the best practices. And if we have these kind of presence, parents are willing to listen.
Right.
Because they are coming here to social media to find answers. Right.
Right.
Don't you agree?
Yes, absolutely. And what we're saying makes sense to them in their lives and their experience, whereas there are other people telling them, no, everything's fine, don't follow your instincts, you're crazy, or you're stupid, or something, which I've heard
Exactly.
people been told some really awful things. It's all in your head. You're a hysterical woman. There's nothing wrong. Breastfeeding's supposed to hurt. All these things, right, that we hear. And then we're saying the things that make them understand that their instincts are right. All the dots connect, as we said in the beginning, and it makes sense for them. And then we provide a path to a solution, not a quick fix all the time, but a path to a solution, which is what everybody deserves, right? It's cool. So I think we have to get to Mexico. How do we make a conference in your town and invite all the IBCLCs to learn there? That's what we need to do.
Yes. I mean, we have, that's why I joined ICAP, and I'm very thankful for all the leadership at ICAP that it was my first conference, and they were trying to find worldwide representation from professionals in different fields. And I was honored enough to get elected.
Yes, congratulations. That's pretty amazing.
And it's already going on in our conversations where the ICAP conference 2026 is going to be held. So, and Mexico is an option. So yeah, we need to keep spreading the word. And yeah, hopefully we'll be here down in Mexico having some really amazing food and nice conversations. Excellent. And amazing learning. I mean, it's a lot that we can do for the families, and it's not only about breastfeeding. It's about neurological development, healthy breathing, healthy growth, healthy microbiome, healthy immune system. Right. I mean, there's so many connections, and I'm happy that we have so many people that are pushing towards that direction. So we have to keep working and learning and staying humble, because sometimes you get to a level where you mention or you identify yourself an expert. And the moment you think you're an expert, even if this is the Tongue Tie Experts podcast, we know we are humble enough to say, the more I know, the more I know that I don't know so many things. Right. And it's important to stay humble and say, especially when you learn that it's so individual. Don't you think, Lisa, I mean, kids come from different backgrounds. It's genetics, environment, emotions. And it's so important to say it's not one size fits all. Yes. It's taking the time, getting to know your families, finding ways to get to these deeper understanding of where they come from, and then also meeting them halfway, don't you think? Right. Meeting them at their level of understanding and meeting their goals. Like I often say, I wish everybody would breastfeed forever until the baby doesn't want to anymore, and never give bottles and all, that's all like ideal world. And we know that not everyone wants the ideal goals that we have or can achieve them due to societal, economical, emotional, family systems, whatever. There's so many things that interplay here. Staying humble and realizing that as experts, we evolve our practice and are open to learning and adapting, right? Like what I'm doing now is different than what I did 5 years ago. Right. And that's how it should be. Right. And that, and I feel like back to you being a pediatrician doing this work, I wish that I knew more pediatricians that kept learning,
most of the pediatricians in my local area, I feel like they haven't learned anything since they graduated or finished their internship. Like it's sad, but that's the truth. Whereas I see nurses and lactation consultants and other therapists continuing to learn. Those are the people I meet anyway, So how do we get other pediatricians to realize that they didn't learn everything in school? Like there's so many things. I mean, not just in this field, right? There's other things. They didn't learn enough about nutrition. We don't learn enough about the microbiome, as you mentioned. Medical school, dental training, everything is usually nursing school, 17 to 20 years behind the textbooks are from real world knowledge.
Yeah, that's why we have to keep building these relationships with other professionals. I was thinking meeting patients where they are. For example, if they end up not breastfeeding, I tell patients from what I learned from many other fields in breastfeeding, it's like, well, let's still optimize suction.
Yes.
For example, even if it's a bottle,
right?
How to pick the right bottle, how to talk about pacifiers, how to talk about posture, right? So many things that we have to maybe not idealize as professionals. As you mentioned, breastfeeding until 3, until the infant doesn't want anymore. But like not putting more anxiety into the lives of our patients. Like, let's try to work step by step and learn what do you need and meet those expectations, right? And also about the learning process is trying to see how everything is connected. I mean, to me, everything starts in the mouth and how do you breathe, and trying to see how it starts even from the womb. It's been impressive. So and as a pediatrician, it's this changing of mindset, like osteopathic medicine. Try do medicine not based on symptoms and treating them. I mean, I think in the Western world, we got so accustomed to just give me the pill for the headache.
Yeah.
Give me the solution for the fever.
Right.
And it's interesting how we're trying to change yourself and me and all the people we know, amazing people, trying to go deep and find the root cause. And I think that does make a difference.
Absolutely. Yeah. So Dr. Erick, you are doing amazing work. I wish I could clone you and spread you throughout all the pediatricians in the world.
That's so good to hear.
Yeah. It's an honor to know you and to have watched your evolution. It's really an honor and to call you a friend. So I want to say thank you and tell everybody how they can reach you. I'll put a link in the show notes, but the best place to find you is on Instagram.
Yeah, I have my Instagram handle, and I also post a lot of things on TikTok.
Okay.
But for the US, especially audience, it's going to be Instagram mostly because, it happens with other social media platforms. But Instagram is my go-to place where you can find me, where I post so many things beyond oral restrictions.
Right.
And I'm so happy that my followers are, my following is growing.
Right.
And
And is your handle Dr. Erick?
It's at Dr. Erick Pediatra.
Okay. And I'm brushing up on my Spanish while you're trying to translate in my head what you're saying. Before I hit translate it, it's teaching me Spanish because I don't know if I've said this on the podcast yet. My son, I have a new daughter-in-law, and she's from the Dominican Republic. And I know my future grandchildren are going to be bilingual. So I really need to learn Spanish.
The next time the interview, when you come down to Mexico for ICAP meeting, or the next time we do an interview or a conversation is going to be initially in Spanish.
Okay, we'll try that. I got to get some kind of program. I got to brush up on it. Would you believe I took 6 years of Spanish, like formally in my schooling? But it was Spanish from Spain. It wasn't the way people actually speak. You know, it was very formal and whatever. Yeah. But it's in the back of my brain somewhere. And we never spoke it. We just read it.
Bring it forward.
Yeah.
Bring it forward.
Yeah, I got to bring it forward. Anyway, okay. Well, Dr. Erick, have a wonderful day. Thank you so much for being here. And everybody follow Dr. Erick on Instagram. He's doing amazing education and outreach on Instagram as well as in his practice. Take care, everybody.
I appreciate this so much.
Okay.
Bye-bye, Lisa. Thank you so much. Bye-bye.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.